Ladies and gentlemen, please welcome to the stage from Les Saintes Gasquillo in Haiti, Marcelle Deschamps.
Good morning, everyone. It's an honor for me to be here with you today from Haiti, with all the catastrophe that we are living down there, that you are all aware, to highlight what, from our point of view, what needs to be highlighted. It has been a very interesting meeting, I would say, and there's so much that I would like to focus on, but we do not have the time. But I'm sure that most of you, deep inside of your mind and heart, you know what you're going to bring back home. So my colleague and I, Ryan, have decided that we will split this session. I will mostly focus on the epidemiologic aspect, the prevention and treatment, and Ryan will cover the other track. So what we have seen mostly is that we all agree that the Caribbean region, with its large diversity, is very complex. However, we have quite similarities that we need to take advantage of to fight this epidemic. The existence of intervention and interrelation and communication within the island with so much variance can facilitate, but also can make the work more difficult because of this migration. We have seen that HIV prevalence varies from 0.1 in Cuba, the lowest, to 3.1% in the Bahamas. There are three categories of countries: those where the prevalence is decreasing, namely Guyana, Haiti, and Jamaica; where the prevalence is stable, Bahamas, Dominican Republic, and Suriname; and where the prevalence is increasing, Barbados, Belize, Cuba, and Trinidad and Tobago. I'm sorry. We have seen also that the heterosexual transmission is the major cause of HIV/AIDS in the region. However, Caribbean is doing well. We have seen the increasing number of individuals who have access to services, access to testing, but funding is an issue. The Caribbean regions, most of the islands, depends on external fundings from World Bank, PEPFAR, and the Global Fund. The groups who are most affected, we have seen, are women, men who have sex with men, sex workers, drug users, prisoners. Those needs to be focused on. There's a need, however, I would say, for more collaborative research within the countries. Focusing on epidemiologic data, there's so much that we could share together: treatment and access to services, vaccine, adolescents, pediatric. We have not much talk about PMTCT, even though in some countries we know that, for example, like the DR in Haiti, PMTCT is still a major issue. And we have not seen enough of behavioral issues. Yesterday in one of the sessions, we talked a lot about ethics. What do you think of having an ethical committee for the region? When we try to do research, we all know that we have to share, we have to present our project to the ethics committee in each country. That can make it more difficult and longer to achieve our activities. So as we saw regarding treatment, Tony Fauci did an excellent job, and by oversight from the 1980s to the 2011, and he pointed out something that I totally agree. The dark era of HIV/AIDS with high rates of death and morbidity is over. We did an excellent job. But there are new challenges to scale up services for early testing, early treatment. We have seen yesterday, for example, that we still have a large number of people in the Caribbean who go to services too late with a CD4 lower than 200. It's unacceptable. We need to do better. We have seen also the correlation in the region with HIV and TB co-infection. And we need to remind that HIV and TB, you can start the treatment at the same time. You don't need to wait to start the TB treatment or the ARV treatment. Prevention and treatment, like Tony said, need to be linked for an AIDS-free generation. And we know how. We know what to do. We have the tools. Education, counseling, condom, STI treatment, prevention mother-to-child transmission. We know what strategy works. There are so many countries where there's no more maternal infant transmission of HIV. Male circumcision is a good tool that we are going to encourage highly in Hispaniola Island, Dominican Republic, and Haiti. Microbicide, we have not tried enough, I think, in the region. Tony pointed out also the need to start the treatment and early and decrease the load of transmitters. Pre-exposure and post-exposure prophylaxis was well discussed yesterday with some limitations still. Bill insists, and I think this is something that we all in the Caribbean need to be prepared. We are vulnerable to natural disaster. And Haiti had seen it last year in the January 12 earthquake, 2010. The whole rescue team was there the day after the earthquake, working with our strategic plan, making sure that patients, volunteers, we are all there with the victims, with the displaced people, and continue the work. And I think what makes it a success is the partnership, the public-private sector partnership, the leadership of the head, the organization, and the commitment of the staff. This is extraordinary. This is something that you cannot leave behind, a staff which is dedicated all time. And with good emergency planning, strong planning. Structures need to be put in place, like we see, to innovate in situation of natural disaster. And I think that's Amelia was saying it yesterday. And no, we need, each country, we need to face the situation itself and come up with a strategic plan. We cannot say because it works in Haiti, it's going to work in Puerto Rico or Bahamas or Barbados. Sustainability. I wanted to conclude in reinforcing what I've heard a lot about sustainability, because everything we do in life is to look at the future. What is it we want to bring home? What is it we want to do at long term? So I think there's a lot that we need to put in place. And public health approach, effectiveness of program. We need to think to be more effective. And as we know, resources are decreasing. We have less funds, so we need to do more with less money. And focusing still on the need of the region, social participation, gender issue, ethic, inequity, behavioral research. Governance is also key. Services and administration costs too high. We need to decrease the cost. And unfortunately, that dependency on external funding. We need to improve access to integrated services, early service delivery, and we need to simplify coordination and management to make it more cost-effective. Conduct more operational research, again, I insist, within the region. We need for monitoring and evaluation, need for evidence-based intervention to learn more from each other. One size does not fit all, so we need to evaluate, innovate, and analyze sustainability